Sepsis coding guidelines. Let's understand sepsis coding basics. Sepsis is a systemic infection caused by microorganisms. It affects the entire body through the bloodstream. Different organisms have different sepsis codes. For example, sepsis due to E. coli is coded to A41.51. Sepsis due to Streptococcus is coded to A40.9. Sepsis due to Staphylococcus aureus is coded to A41.2. So whenever the organism is documented, we should assign the sepsis code based on that organism. In this question, the organism causing sepsis is E. coli. So we should assign the organism-specific sepsis code. A 41.51 represents sepsis due to E. coli. A 40.9 is for streptococcal sepsis. A 41.2 is for staphylococcal sepsis. A 41.9 is unspecified organism sepsis. So the correct answer is C, a 41.51. When coding sepsis, always check whether the organism name is documented. If the organism is known, we should assign the specific sepsis code. For example, streptococcal sepsis is coded to A40.9. Staphylococcal sepsis is coded to A41.2. Specific coding is always better than unspecified coding. In this case, the diagnosis clearly mentions Streptococcus as the organism. So we assign the streptococcal sepsis code A40.9. A41.9 is incorrect because the organism is known. A41.2 is for staphylococcal sepsis. R65.20 represents severe sepsis without septic shock, not the organism code. So the correct answer is C, A40.9. If the organism causing sepsis is not documented, then we assign unspecified organism sepsis code A41.9. For example, if the impression only says sepsis, we assign A41.9. Similarly, septicemia is also coded to A41.9. So when no organism is mentioned, use unspecified organism code. In this scenario, the diagnosis is septicemia, but no organism is documented. So we assign unspecified organism sepsis code A41.9. Specific organism codes cannot be assigned without documentation. So the correct answer is D, A41.9. If organism is known, then assign specific code. If unknown, organism code A41.9. Let's understand severe sepsis coding. Severe sepsis means sepsis associated with acute organ failure. When a patient develops organ dysfunction due to sepsis, it becomes severe sepsis. In severe sepsis cases, we usually need 3 codes. First, assign the sepsis code based on the organism. Second, assign the severe sepsis code. Third, assign the acute organ failure code. So remember, sepsis plus organ failure equals severe sepsis. In this question, the patient has severe sepsis caused by Staphylococcus aureus and acute respiratory failure. So first, we assign the sepsis organism code A41.01. Second, we assign the severe sepsis code R65.20. Third, we assign the organ failure code J96.00 for acute respiratory failure. So the correct answer is B. Now focus on the sequencing rule carefully. The sepsis code should always come first. After that, assign the severe sepsis code. Finally, assign the code for organ failure. Never code organ failure before sepsis in severe sepsis cases. This sequencing is very important in CPC exams. In severe sepsis cases, the underlying sepsis organism code should always be sequenced first. So first we assign sepsis due to E. coli, then severe sepsis code, then acute kidney failure code. So the correct answer is C. One important point. Severe sepsis requires acute organ dysfunction. Without organ failure, we should not code severe sepsis. So always check documentation carefully for acute organ failure such as acute respiratory failure, acute kidney failure, acute liver failure. Then assign the severe sepsis code. In this question, the patient has sepsis, but no organ failure is documented. Without acute organ dysfunction, we cannot assign severe sepsis code. So only the sepsis code should be assigned. The correct answer is B, no. If sepsis and organ failure is documented, then code severe sepsis. Remember the sequence: organism first, then code severe sepsis, and then organ failure at the last. Let's see septic shock coding now. Now, let's understand septic shock coding. Septic shock is a very severe form of sepsis associated with circulatory failure. It can reduce blood supply to organs and may lead to multiple organ failures. In septic shock cases, we assign the sepsis organism code first, followed by septic shock code, and then all associated organ failure codes. So remember, septic shock is more severe than severe sepsis. In this case, the patient has meningococcal septic shock with 2 organ failures. First, we assign the organism sepsis code A39.4. Second, we assign septic shock code R65.21. Then we assign the organ failure codes J96.00 for acute respiratory failure and N17.9 for acute renal failure. So the correct answer is B. Now focus on the sequencing carefully. The sepsis organism code should always come first. After that, assign septic shock code R65.21. Then assign all acute organ failure codes separately. If multiple organs fail, all organ failure codes should be assigned. In septic shock coding, after assigning the organism sepsis code, the next code should be septic shock code R65.21. Only after that do we assign organ failure codes. So the correct answer is C. One important point: septic shock is more severe than severe sepsis because circulatory collapse develops. Patients may develop multiple organ failures such as acute respiratory failure, acute kidney failure, acute liver failure. So always look carefully for organ dysfunction documentation in septic shock cases. Septic shock equals severe sepsis plus circulatory failure. Important exam memory trick: organism first, then shock code next. Code organ failures last. Sepsis sequencing guidelines. Let's understand sepsis sequencing guidelines. If the patient is admitted with both systemic infection and localized infection, we should code the systemic infection first. Sepsis is a systemic infection because it affects the whole body. Conditions like UTI and pneumonia are localized infections. So in cases of sepsis with UTI or pneumonia, sepsis should be coded as principal diagnosis followed by the localized infection. In this case, the patient has both systemic infection and localized infection. Sepsis is systemic while UTI is localized. According to guidelines, systemic infection should be coded first. So the correct answer is B, sepsis first followed by UTI. Now let's understand another important rule. If the patient is admitted for one condition and develops sepsis later during hospitalization, then sepsis should be coded as secondary diagnosis. This is because the original reason for admission remains the principal diagnosis. In this scenario, the patient was originally admitted for burn treatment. Sepsis developed later during hospitalization. So the burn remains the principal diagnosis and sepsis is coded as secondary diagnosis. So the correct answer is B, burn first, sepsis second. One important exam point is urosepsis. Urosepsis is a non-specific term. It does not clearly confirm sepsis or UTI. So whenever documentation says urosepsis, we should query the provider for clarification. Another important point is pregnancy-related sepsis. For pregnant patients, separate pregnancy complication codes are available, so normal sepsis sequencing rules may not apply. In this question, the diagnosis is only urosepsis. Urosepsis is a non-specific term and does not clearly indicate whether the patient has sepsis, UTI, or both. So the provider must be queried for clarification before assigning codes. So the correct answer is C. Query the provider. Systemic infection first, sepsis after admission, then code secondary diagnosis. Admitted with sepsis, code it as PDX. Develop sepsis after admission, then code sepsis as SDX.